Hello everyone, Blake and I just wanted to go through the new setup for our Merit bag. We're going to have a new Merit Med kit. The goal of this kit is to not have to bring in the orange box for every call. With this, we should be able to handle roughly the first 10 minutes of any call that we go on. It's worth noting the orange box will remain the same. Nothing is changing with that. We are just double redundant on a couple of medications that are in here. To unattach the med kit from the bag, there is going to be one zipper. It'll be velcroed on the top and the bottom. You just got to take the zipper and it'll come right off. Inside the bag, for medications, we have our cardiac drugs. We have our adenosine, our amiodarone, nitro, and then we have Versed and Zofran. For allergies, we have our Epi 1-to-1 and our Benadryl. We have our MAD device and various size needles to draw and syringes to draw up the medication and administer it. In the flap here, we're going to have our aspirin, 2 boxes of Epi 1-to-10, our Narcan, atropine, lidocaine, and D50. The inner flap, we have all of our IV setup. We have a couple setups for flushes and our saline locks with some Coban, our tourniquets, 24 gauge, 22 gauge, 20s and 18s, along with alcohol preps, and our transport tape. This is just a trial run. It's going to be on Medic 2. We are planning on running the trial from June 7th to October 31st. We're looking for feedback, what goes well, what doesn't go well, any changes that we might need. It's also in the mornings to make checks easier. It'd be best if the medics could get together and talk about what kind of calls they had the day before. You don't have to be descriptive, just say, hey, we had a code, might be good to go through the bags this morning. Otherwise, we can use a tagging system and you'd only have to check it after the tag's been broke, which means it's just been used.
There are also foam inserts where the vials of medication are. Those are loosely placed in there to hold pressure on the vials so they don't fall out. Please be mindful of them.
Right there.
Try to keep those with the medications at all times.
The saline is also going to be in the inside flap where it's always been, and along with your drip set. And then right now this doesn't have a whole lot in it other than your 14s and 16s. We'll look to possibly expand on that in the future. And Blake is going to go over our new trauma setup.
So as you can see, we took the flap from this main compartment zipper. We took that off. Those contents have been placed in the wings. On our right, we have a thermometer, glucose, Narcan. On our left, we have the razor, bite block, tape, and Band-Aids. Inside the flaps that were replaced, we have another one. And we took the trauma stuff out of the wings, and we have now placed them in here. On the left, in this white bag, you have your dressings, 4x4s, 8x10s, hemostatic gauze, tourniquets, both of them are in here, and the pen light. And then on this side, we have bandaging, triangle bandage, ace wrap, cling wrap, Coban tape. So these are nice because they can just easily be removed in case we have multiple patients or tight access. They're easily removed and able to be used. Again, we're looking for feedback on this. If you have any changes to be made to either of these kits, please come to Dylan or I, and we'll try to see what we can do to make this the most efficient we can.
The inventory sheets will also be updated accordingly as well for Thursdays.
Brought to you by the men and women of Watertown Fire Rescue.